Hi, welcome everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Mr. Oliver D. Organista. Oliver obtained his animal science degree at Nueva Vizcaya State University in the Philippines. He's also an alumnus of the Ateneo School of Government. Currently, he's pursuing his postgraduate study in research and development management at the University of Philippines Open University, and also works as a diagnostic specialist at Bioguard. As everyone knows, FeLV and FIV are the most common infectious disease of cats. Both viruses can be transmitted horizontally through saliva or other body fluid, and vertical transmission probably also occurs. As FeLV is mainly shed in saliva, FIV is transferred from cat to cat, primarily by saliva through deep penetrating bites. Both viruses can cause many types of illness as well as deaths in infected cats. Information including etiology, diagnosis, and management of both diseases will be discussed in this webinar. So we are glad to have Mr. Oliver as our guest speaker for this webinar. Without further ado, let's welcome Oliver.
Yes, hello, good evening. Can you hear me, Dr. Robert? Hello?
Yes.
Yes, okay, yep. Yes. Yeah, hello everyone. It's a pleasure to be here today to talk about the feline leukemia virus and feline immunodeficiency virus. And Dr. Robert, thank you for the introduction. Yeah, so I hope that after this webinar, we'll be able to identify the stages or phases of the disease and how to diagnose them using different methods and how to interpret the results. Also in this session, I will be presenting in this manner. First, I will discuss about the feline leukemia, and then afterwards, I will be discussing the feline immunodeficiency virus. So before I begin introducing our topic for today's webinar, I would like to invite you to follow Bioguard by scanning these two QR codes for their Facebook and LinkedIn. So I will give you a minute to do this. Right? So today's webinar is about the two important retroviruses that affects the feline population worldwide. So these retroviruses affects the immune system of the patient. So this image shows a structure of a retrovirus with its different components and like proteins and enzymes and others. So what is a retrovirus? So a retrovirus is a type of RNA virus that inserts a DNA copy It has the ability to reverse transcribe its RNA genome into a cDNA copy that can then be integrated into the host genome. The presence of two single-stranded RNA, these two RNA copies with its genomes grants this virus enhanced replicative efficiency. So retrovirus uses reverse transcriptase enzyme to convert RNA into DNA. So the viral DNA integrates into the host cell's genome and relies on the host cells to replicate the good the good examples of this virus are the feline leukemia virus, the feline immunodeficiency virus, and the human immunodeficiency virus. So what is feline leukemia virus? If you heard feline leukemia, cat leukemia, or feline cancer virus, so these names are referring with the FeLV. So as I mentioned earlier, FeLV is a type of retrovirus. So this virus, which may induce depression of the immune system, anemia, and lymphoma. It was discovered in 1964 in cats with leukemia or cancer of the white blood cells. It is one of the most common infectious diseases in cats, affecting between 2% and 3% of all cats in the United States. Yeah, the virus is a single-stranded RNA in the genus Gamma retrovirus belonging to Retroviridae family. So this is the structure of the FeLV virion. So the virion is the complete infectious form of the virus. It is made up of a protein capsid that encloses the RNA genome and other viral proteins. The surface glycoprotein is located on the outer surface of the virion and helps it to attach to the host cell. The transmembrane glycoprotein, or GP4T, so this protein is embedded in the viral membrane and helps to mediate the fusion of the viral envelope with the host cell membrane. The nucleocapsid protein, so this protein forms a shell around the RNA genome and helps to protect it. The P15, or the matrix protein, so this protein is located between the nucleocapsid and the viral envelope and helps to assemble the virion. The enzyme reverse transcriptase is essential for the replication of the FeLV genome, while the integrates integrate the FeLV DNA genome in the host cell DNA. And the capsid protein, the P24, is the protein forms of the main structural component of the viral capsid. So the mode of transmission, so for feline, the FeLV is transmitted primarily through direct contact with infected saliva and urine. This can happen in several ways, like mutual grooming. So cats spend a significant amount of time grooming each other, and also during grooming an infected cat, the virus can be transferred through saliva. Can also transmit through bite wounds. When cats fight, bite wounds can provide a direct route for the virus to enter the bloodstream of an infected cat. Shared food and water bowls. When cats share food and water bowls, the virus can be transmitted through contaminated saliva and urine. Mother to kitten. A pregnant cat infected with FeLV can pass the virus to her kittens before birth, through the placenta, and after birth through her milk. So the cats that are at most risk for FeLV infections are young cats and older cats, cats that live outdoors, unneutered cats, unneutered male cats, cats with other diseases, cats in multi-cat households, cats in catteries, and unvaccinated cats. So there are these three stages of FeLV infection. First, the abortive infection, then the regressive, and the progressive infection. The abortive infection is one of the possible outcomes after a cat exposed to the virus. So what is happened during this stage? So the cats the cat comes into contact with the FeLV, usually through saliva or nasal secretion from an infected cat. Then the cat's immune system responds to the presence of the virus and produces antibodies that fight off the infection. If the immune system successfully eliminates the virus before it can integrate the cat's lymphocytes, then the lymphocytes are a type of white blood cells that is part of the immune system. So the only indication of the FeLV infection during this stage is the presence of antibodies. These antibodies are the proteins produced by the immune system to neutralize the virus. The next stage is the regressive infection. So during this stage, it's like similar to the abortive stage. The cat comes in contact with the FeLV, usually through saliva or nasal secretions from the infected cat. Then the cat's immune system partially responds to the presence of the virus, and it manages to control the virus of the infection before a secondary viremia occurs. So during this stage, the virus is present in the bone marrow, but there is no or minimal evidence of the secondary infection, which means that the virus is not actively replicating and spreading throughout the cat's body. However, the integrated provirus retains its replication's capacity, so reactivation can still occur many years after the initial exposure to FeLV during the regressive infection. So a regular veterinary care and monitoring are crucial for cats with regressive states of FeLV infection. So the next stage is the progressive infection. So the progressive stage of FeLV is a stage where the virus is not contained during the early stage and leads to extensive viral replication. So the cat, what happens during this stage? So the cat comes in contact with FeLV, usually through the saliva or nasal secretions from an infected cat. And there is an extensive viral replication first in the lymphoid tissue, then the bone marrow, and subsequently in mucosal and granular epithelial tissues. And this associated with the excretion of infectious virus, mainly in saliva, but also other secretions. So if the immune system does not eliminate the virus after initial exposure, FeLV spreads to the bone marrow and affects hematopoietic precursor cells. So this can cause either cellular proliferation, resulting in lymphoma or leukemia, or myelosuppression. A cat with a progressive infection has undergone infection of the bone marrow and secondary viremia during the secondary viremia. So this means that the virus is present in the bloodstream and is at increased risk of shedding the virus and developing FeLV related diseases. So over time, an infected cat's health may progressively deteriorate, or he may experience repeating cycles of illness and relative health. Signs can include loss of appetite and progressive weight. So what are the most common clinical signs for a persistently FeLV viremic cats? So first is anemia, immune suppression, predisposition to other infections, and lymphoma. Other symptoms are lethargy, fever, pallor, stomatitis. Less common are lymphoma in gastrointestinal and renal and cutaneous and ocular parts, other neoplasias, immune-mediated uveitis, reproductive disorders in viremic veins, and also peripheral neuropathies. So this is a study conducted in Russia. So as you can see, there are the red blood cells is this decreased, even hemoglobin and hematocrit and platelets, as well as the lymphocytes. But the band neutrophils and erythrocyte sedimentation rate are increased. So for band neutrophils, the increase of the band neutrophils suggests that FeLV positive cats experience inflammation. So clinical syndromes observed in FeLV positive cats are gastrointestinal, non-specific, immune-mediated, respiratory, urogenital, dental, and others. So for the gastrointestinal, during this study, they observed that the cats are vomiting, they have diarrhea, and when using an ultrasound, it was observed that hepatitis, splenitis, cholecystitis, and pancreatitis are also present during in FeLV positive cats. For the non-specific, the signs that they observe are they are lethargic, they have fever, hypothermic, anorexic, dehydrated, and there are free fluid in both chest and abdominal cavity. For the immune-mediated, they are anemic. They have icteric and lymphadenopathy. Neoplastic lymphoma is the most common disorder observed during the study for the neoplastic part. For urogenital, urolithiasis is present. Dental is gingivitis, stomatitis, and gingivostomatitis, and also periodontitis. For the biochemical and electrolytes, abnormalities for the FeLV positive cats in this study, the glucose, the urea, AST, the C-reactive protein are all increased, and the potassium and sodium are decreased. So for the diagnosis, you can use the ELISA or the enzyme-linked immunosorbent assay or immunochromatography. So the ELISA test is usually performed first as a screening tool and can be run in a veterinarian's clinic. It detects a protein, the P27 protein component of the virus, indicating an active FeLV infection. So the P27 protein is a viral core protein associated with FeLV and is produced during active viral replication. Detecting the presence of P27 is crucial for early detection and management of FeLV infections. So cats diagnosed as persistently infected by ELISA testing may die within a few months or may remain asymptomatic for longer. The median survival time after diagnosis is 2 to 2.5 years. So another method for diagnostic is the PCR or the polymerase chain reaction. So this test is used to detect a few days to weeks after FeLV exposure. They detect the proviral DNA, a DNA copy of viral RNA integrated into the cat's genome. Another one is the RT-PCR or reverse transcriptase. So this test is used to detect the plasma viral RNA, usually within 1 week of FeLV, 1 week of infection. So next is the IFA. So IFA or the indirect immunofluorescent antibody assay. So these tests are used to detect the free soluble FeLV P27 antigen or the virus core protein, usually after 3 to 6 weeks. So please bear in mind that it might not be possible to determine a cat's infection status based on a testing at a single point in time. So repeat testing is using different methods could be required. Also, confirmation of positive in-clinic screening results is recommended. So this is just a summary of the stages of infection. So for the progressive infection, during progressive infection, using the blood sample, the P27 antigen is present during the progressive infection. It can also detect the viral RNA in blood and viral DNA. So the result is positive after exposure of 30 days, and there is likely FeLV associated disease during this stage. For the regressive infection, the result can be negative or positive on the POC. So it negative if it's less than 12 weeks, and it's positive if positive in a viral DNA. If so, this is a diagram of how to test a patient. So the first step is to ask if the cat has a clinical suspicion of FeLV. So this means that the cat is showing signs of illness that could be caused by FeLV, such as fever, weight loss, or lymphadenopathy, or the enlargements of the lymph nodes. So if the cat does not have a clinical suspicion of FeLV, then it's unlikely to be infected. However, if the cat has been exposed to FeLV in the past 6 weeks, or if its lifestyle has changed, it becomes an outdoor cat, then it's still possible that the cat's infected. So in this case, the veterinarian should retest the cat's blood for FeLV proviral DNA using the PCR test. If the cat does not have a clinical suspicion of FeLV, then the next step is to test the cat's blood for free soluble P27 antigen. So this is a quick and easy test that can be done in veterinarian's clinic. If the P27 antigen is negative, then the cat is unlikely to be infected with FeLV. However, if the P27 antigen is positive, then the cat is likely to be infected with FeLV. If the cat is likely to be infected with FeLV, then the veterinarian will need to do some additional tests to confirm the diagnosis and to determine the stage of the infection. So these tests may include a retest for P27 antigen after 6 weeks, or a test for viral RNA, or a test for proviral DNA. So for the disease management, supportive therapy, including fluid therapy if required, and good nursing care are essential. FeLV infected cats should remain indoors and receive regular clinical checkup for every 6 months. Secondary infection should be treated promptly. So feline interferon omega may reduce clinical signs and extend the survival rate. Cydovodine, may be induced, but side effects may occur. So cydovodine is an antiretroviral drug. It is the only antiviral drug used to treat FeLV and also FIV. The viral load can be decreased by using this drug and improving the patient immunologic and clinical status. Corticosteroids at high doses, other immunosuppressive or bone marrow suppressive drugs should be avoided unless used as a treatment of FeLV-associated malignancies or immune-mediated disease. For the vaccination recommendations, all cats of uncertain FeLV status should be tested prior to vaccination for P27 antigen and preferably also for FeLV provirus. Progressively infected cats should not be vaccinated against FeLV. Regressively infected cats do not need to be vaccinated against FeLV. FeLV vaccination is not a core vaccine. However, all healthy cats with a potential risk of exposure should be vaccinated against FeLV. Kittens should be vaccinated at 8 to 9 weeks of age with a second vaccination at 12 weeks, followed by a revaccination 1 year later. For the older cats, FeLV boosters can be given every 2 to 3 years after the age of 3 years. So FeLV is recommended as a core vaccine for those cats younger than 1 year old. Sorry. For the recommendation vaccination, so yeah, these are the sites that for introducing the vaccine, so only for the limbs and the tails. This is recommended by the AAHA.org. You can visit their website here. So next retrovirus is the FIV or the Feline Immunodeficiency Virus. So the virus, the FIV, discovery and origin. So it was first isolated in 1986 by Niels Petersen and Janet Yamamoto at the UC Davis School of Veterinary Medicine. And this discovered the virus in a colony of cats that had a high prevalence of opportunistic infections and degenerative conditions. FIV originated among wild felids in Africa between 5 and 2.5 million years ago, disseminated through the Panthera lineage and ancestors of the African lion. Then globally among New World cats as a species-specific strains. FIV is genetically more closely related to ungulated retroviruses like the equine infectious anemia, the bovine immune deficiency virus, caprine arthritis encephalitis virus, but resembles primate lentiviruses in its ability to cause a clinical immunodeficiency. So yeah, FIV is an RNA lentiviruses in the same retrovirus family as Feline Leukemia Virus and HIV. So FIV is a slow virus that comprises compromises the immune system of cats over a period of years by infecting many cell types. So it's an endemic in domestic cat population worldwide with a from 2.5 to 4.5% cats population are infected. Seroprevalence varies, depends on the regions. So before we go further with the FIV discussion of FIV, let me introduce lentivirus. So lentivirus is a type of retrovirus that causes chronic, progressive, and usually fatal diseases in animals. Lentivirus are classified into 5 serotypes based on the vertebrate host they infect: bovine, equine, feline, ovine, caprine, and primate. They can infect both actively dividing and non-dividing cells. Lentiviruses are used to insert long DNA segments into the dividing cell lines, primary cells, neuronal cells, stem cells, and hematopoietic cells. So the structure of FIV virion. An FIV virion is shown as adjacent to the surface of the C4 plus T cell. So lentivirus contain 2 identical strands of RNA or the viral genome and associated enzymes, which includes reverse transcriptase, integrase, protease that package into a core composed of the P24 capsid protein with the surrounding P17 protein matrix, all enclosed by a phospholipid membrane envelope that is derived from the host cell. Viral encoded membrane proteins, the GP41 and GP120, are bound to the envelope. The CD134 and CXCR4, the chemokine receptors on the host cell surface, function as the receptors of the FIB. So characteristics of FIB, they are highly specific, long incubation period, they have a gradual progression. So for the prevalence of FIB, FIB can be found worldwide. So in this figure, the highest percentage of FIB can be found in Japan with 23% among these listed countries here. So this indicates that a relatively high presence of FIB in Japanese cats. Second is Thailand with 20% prevalence. And in Australia, it has a moderate prevalence of approximately 15%, suggesting a notable but not extremely high presence of FIB in the cats population. New Zealand has a lower prevalence compared to Australia, with around 10% of the tested cat population being positive for FIB. Both Canada and UK have a prevalence of 6%, which indicates a moderate presence of FIB in the tested cats population of these countries. The USA, the United States, and also Poland has a lower prevalence of approximately 4%, indicating a relatively lower presence of FIB. And in Germany has a lower prevalence of around 3%, indicating relatively lower presence of FIB in the tested cat population compared to any other countries on this list. And Mexico also has a prevalence of 3%. Indicating a relatively lower presence of FIB. So there are 7 subtypes or clades of FIB. We have the A, B, C, D, E, F, and the U and Z, E and D or envelope. Identified to date based on the nucleotide sequence differences. So these differences may impact disease associations and virulence. The distribution of the clades varies, with subtypes A and B are being the most common. Subtypes C are less common. In Europe, clades A and B are present. Clades A, B, and C are present in USA and Canada. Clade A are present in Australia and Africa. And in South America, the clades B and E are present. In Asia, clades A, B, C, and E are present. And also A, B, C, and D are present in Japan. So subtype D can only be, they only found the case in Japan for the subtype D or the clade D. In New Zealand, 3 subclades are present, the A, C, and U, and Z envelope. And Vietnam also has the clade D. Transmission, so the primary transmission of FIB is by bite wounds. This mode of transmission often occurs among untutored adult cats with outdoor access, who are more likely to engage to aggressive behaviors such as fighting. In rare cases, a mother cat may transmit the infection to her kittens. So the risk of transmission increases if the mother becomes infected with FIV during her pregnancy. While sexual contact is not typically a common method of transmission for FIV, it is theoretically possible if there are bite wounds or injuries involved during coitus. And lastly, for the blood transmissions from an infected cat to another cat can also potentially transmit the virus. So when infected blood is transfused into a healthy cat, the virus enters the bloodstream and can infect the recipient's cat. The virus does not survive long outside the host cat and is susceptible to disinfectants. So sharing a litter box, sleeping areas, toys, or water bowl or other items will not transmit FIV between cats. Sick adult cats, male cats, and free-roaming cats are most likely to be infected with the virus. So risk factors, there is a high risk of FIV infection in an adult cat, male, unneutered, and has access outdoor, mixed breed, and sick. The average age at the time of diagnosis is 6 years, and with male cats being almost 5 times more likely to be seropositive than females in this study. So there are 3 phases of FIV infection. We have acute phase, asymptomatic or the latent phase, and progressive phase. For the acute phase, the acute phase of infection generally occurs 1 to 3 months after infection. At this time, the virus is carried to lymph nodes where it reproduces in white blood cells known as T lymphocytes. Clinical signs during this period include transient fever, anorexia, neutropenia, and generalized lymphadenopathy. Next phase is the asymptomatic phase. So during this time, the virus replicates very slowly within the cells of the immune system, and cats will not show any outward signs of illness. Infected cats may exhibit blood work abnormalities such as low white blood cell levels or increased blood proteins. Some cats will remain in this stage and never progress to more severe disease. The next phase is the progressive. So as the virus continues to spread through the immune system, cats will enter a progressive immunocompromised state during which secondary infections may occur. Most illness related to FIV is caused by these secondary infections or problems with the immune system. The progressive phase of FIV infection is the classical form of feline AIDS, often marked by the emergence of multiple degenerative, neoplastic, and secondary infectious diseases, including chronic periodontal disease, weight loss, tracheobronchitis, abscesses, neurologic disease, and lymphoma. And cats may develop chronic or recurrent infections of the skin, eyes, urinary tract, or upper respiratory tract, and inflammation of the gums, and severe dental disease known as gingival-stomatitis is common in cats infected with FIV, and they are significantly more likely to develop cancer and immune-mediated blood disorders than healthy cats. Weight loss, seizures, behavioral changes, and neurological disorders are all possible during this phase, and the severity of this illness can vary greatly, but once cats becomes ill with multiple critical infections or cancers, the survival rate time is usually no more than a few months. So for the diagnosis, there are 4 diagnostic methods that are being used to detect FIV. So first is the point of care test or the POCT. so which are usually ELISA or immunochromatography based for the detection of antibodies against the FIB in blood. So another one is the laboratory assays. This is to confirm the POCT results. Usually they use a plate ELISA, immunofluorescence assay, or Western blotting, which all detect antibodies against the FIB in blood. Next is the molecular methods, or the PCR, polymerase chain reaction. This is to detect the proviral DNA or the RNA integrated as DNA in cat's blood. So for the virus isolation, they use heparinized blood to detect the replicating virus. And so for the POCT, you can use the Bioguard's FIB combo to detect the antigen antibody of the cat. For the molecular method, you can use the Bioguard's Q-mini to detect the proviral DNA of the FIB and also the viral RNA. If you are interested to purchase or to this test kits or machine, you can directly send an email to service@bioguard.com.tw or contact our local distributors in your country. So this is the diagram on how to detect or diagnose the FIB. So first is starts by asking whether the cat has any risk factors or clinical problems that could be associated with the FIB. If the cat does not have any risk factors, then it is unlikely to be infected with FIB. If the cat does have risk factors, then the next step is to test the cat for FIB antibodies. So there are two types of FIB antibody tests. We have the POCT test and the laboratory test. For the POCT test are quick and easy to do, but they are not as accurate as laboratory tests. The laboratory tests are more accurate, but they take longer to get the results. If the cat's test is negative for FIB antibodies, then it is unlikely to be infected with FIB. However, if the cat is less than 6 months old, it is possible for it to be infected with FIB, but still be antibody negative. In this case, the cat should be retested for FIB antibodies in 3 to 6 weeks. If the cat tests positive for FIB antibodies, then it's likely to be infected with FIB. However, there are a few other possibilities, such as if the cat received maternal antibodies from an infected mother. So to confirm the FIB infection, the cat should be retested using a different type of test, such as a plate ELISA, the immunofluorescence assay, Western blotting, PCR, or the virus isolation. So once a cat is diagnosed with FIB, there is no cure, but there are treatments that can help manage the infection and prolong the life of the cat. So these treatments include antiretroviral therapy, supportive care, and treatment of any secondary infections. So for the disease management, FIB positive cats should never be euthanized because with proper care and management, FIB positive cats can live relatively normal lives, and neutering is recommended to reduce the aggression and decrease in biting incidents. Neutered cats are often calmer, less aggressive, and less likely to roam. FIV-infected cats should be kept indoors and receive regular veterinary health checks every 6 months, including routine biochemistry, hematology, and weight monitoring. So keeping FIV-infected cats indoors helps to prevent the spread of the virus to other cats, and it also minimizes the exposure to infectious diseases, which is important because FIV weakens the cat's immune system. Prompt and accurate diagnosis of secondary illnesses is essential. The earlier these diseases are identified, so the earlier treatment can start. So in shelters, cats should be housed individually to avoid cross-infection. AZT or azithromycin may be used as for treating FIV infection for the secondary infection, but side effects may occur. Perioperative antibiotic treatment is also required during surgery, and to avoid iatrogenic virus transmission, a proper care for the surgical instrument that have been used to seropositive cats should be decontaminated, like autoclaving. So for the vaccination, so a vaccine was previously available but was discontinued since 2017 in US and in Canada. Due to the ineffectivity to protect the cats from the virus. So the FIV vaccines also led to the false positives, which could lead to unnecessary euthanasia. So there is also a limited protection against the virus when they use this vaccine. And also it needs a frequent boosters to stay effective. So the countries who are still using the FIV vaccines are Australia, but there is a current supply issue of this vaccine, and it may not be available until the mid-year of 2024. Also the vaccine is still present in New Zealand, so they are still using it, and also in Japan. Yep. So those are the informations for this today's webinar. So for the further readings, you can for the further readings you can visit these websites or organizations like the American Animal Hospital Association to get more information about these two retroviruses. Also, the European Advisory Board for Cat Diseases, Cornell Feline Health Center, the Merck. You can also check the Merck manual, and also for the study that I just presented, you can visit the Veterinary World to check the results of the study. So thank you. So for your questions, you can just send on the chat box. So for question 1, how can we vaccinate a cat infected by FIV, FeLV with 4 vaccine? Yep. But still, you need to check for the FPV first, and then using the inactivated vaccine. So for the second So, and also the best way to prevent your cat from getting FIV is also by screening and testing of cats in your household at your before bringing a new cat in the household. The common FIV and FeLV test must do, and if your cats are negative. So that's so frequent. So how for this another question? So how long maximum time we can use corticosteroid to cat infected with FIV and FeLV? So for this one, we will try to answer this after this webinar because I don't have any idea about this. The maximum time. Sorry for this to the anonymous attendee. Another question is, what if my cat was diagnosed with FIV? What if my cat was just diagnosed with FIV? So if your cat was just diagnosed with FIV, so yeah, don't worry with that one because the cats can still live with this type of disease for years as compared to FeLV. Yeah, as I mentioned a while ago, FIV is the progression is gradual, unlike FeLV. So the cat can live as long as you give him the supportive treatment and also addressing the secondary infection. So is it practical to give the vaccine to an infected cat with FIV? So this one is no, because there is no more effect especially if the cat is already in a progressive state. So for any other antibiotics works in this disease. So for these two diseases, the one that because this disease has no treatment, the only one that we are addressing during treatment is the secondary infections. Okay, so for those who are requesting for the copy of this presentation, so we already have your emails and we will send it after this webinar.